I think the best advice Dr. Haynes gave me was his best therapy is to go out and be a kid. Ride his bike, swim in his pool, play with his friends, go on his trampoline. Like, that is going to be the best therapy to get him back into his regular regimen. And he was absolutely right. My name is Jennifer Therian, and I am Michael's mother.
My name is Michael Therian. I'm 11 years old, and I'm here to talk about my Achilles release.
When Michael was about 7 years old, we noticed he started to walk a little bit on the side of his foot and that his toes were sticking up. That prompted us to see Dr. Haynes and seek the help of an orthopedic. It wasn't bothering him, but we were afraid that as he continued to grow, that the problem might get worse, so we thought it would be best to seek expert advice. I found Dr. Haynes because I am a patient of Dr. Marks at Seaview Orthopedics, and I asked him for a referral to a pediatric orthopedic, and he referred Dr. Haynes. What I loved about our first meeting with Dr. Haynes was that he did not even mention surgery the first time. The first time we met with him, we talked about the issues that Michael was having and how different ways that we could help correct it, and none of them involved surgery. So we went down some non-surgical routes. He had custom orthopedics in his shoes to help his limb length discrepancy, and he did a lot of physical therapy. So we were able to explore non-surgical options before we got to the point where surgery was necessary. Michael had an Achilles contracture, which caused the Achilles to be very tight and then pull on his foot. Michael had one leg that was shorter than the other, which is not uncommon, and Dr. Haynes reminds me of that at every single appointment. But it is caused by his Achilles contracture because the Achilles pulls so much on his foot, it doesn't let his leg grow as quickly as the other side. My husband and I decided that it was time for Michael to have surgery after about 2 years of physical therapy, and in consultation with our therapist, we were at a point where we had kind of maximized his progress, and at that point we decided it was time to do the surgery. Dr. Haynes had discussed with us several times that surgery would be an option, and it would probably be at some point in his future, but understood that we weren't willing to jump the gun and just put him under the knife, from the very beginning, which was very comforting. Michael was great after surgery. I was really impressed with how Dr. Haynes kept in touch with us during the surgery, came out and met with my husband and I halfway through to let us know how things were going. The hospital was terrific. They taught him how to use his crutches. He was a pro on his crutches, speeding all around the hospital before he was released. We wanted a doctor that specialized in pediatrics because we wanted somebody who understood that he still had a lot of room to grow. As a 10-year-old boy, he still has feet to grow before he maximizes his height, and we wanted to make sure that when we did surgery that we didn't impede on any of his future growth. We love Seaview Orthopedics. We love Dr. Haynes. I've recommended Dr. Haynes to so many people personally, in local Facebook groups for people who were looking for a pediatric orthopedic. I love his bedside manner. I love that he explains things to me, but then explains things to Michael in a way that he can understand. I love that he gives me options for his care, and he was terrific when it came to helping me manage his pain after the surgery. I'll tell you, he was terrific. Like, when he was allowed to go back into sports and when he was allowed to, start doing things. And one day in the spring, it was just such a beautiful day. And of course, with COVID, we had been locked in the house for so long. And I said to him, "Go ride your bike." And he had just gotten out of the boot. And He kind of looked at me like, are you crazy? And I said, Dad will go with you, and Dad will, make sure that you're okay. And if the minute you don't feel okay, just, come home. And so we started with little things to get him moving. But I think the best advice Dr. Haynes gave me was his best therapy is to go out and be a kid. Ride his bike, swim in his pool, play with his friends, go on his trampoline. Like, that is going to be the best therapy to get him back into his regular regimen. And he was absolutely right. I would tell other moms or other parents, to go with your gut instinct. When you think there's something that is not right, you need to see a professional who can help you through it.